All right, everybody, welcome to our usual Sunday town hall slot, except that it's not at all our usual Sunday scene. I'm being joined today by two other candidates, Lynnette Grable, who is running for U.S. House, and Jackie Grimes, who is running for its Senate District 10 in Wyoming, and Carrie Murthy, who I'm actually just going to turn it over to right now, who's the chair of the Albany County Dems, and she's going to be moderating and asking questions today of the three of us, and I'm just super grateful for all three of you to be here. So thank you, Carrie. It is your floor.
Okay, thank you, Yana. I am thrilled and honored to be here moderating this town hall today with a few of the wonderful progressive women candidates that we'll get to see on the ballot this year. So I'll jump right in and kind of do a quick introduction of the three candidates we have. So Lynnette Grable is running to represent Wyoming in the U.S. House of Representatives. Her home is on the Wind River Indian Reservation, and she describes herself as a proud Native American who aspires to give voice to and serve all people of Wyoming. And she says it is long overdue that we actually put equality in the state. Yana Ludwig is running to represent Wyoming in the United States Senate. Yana lives in Laramie and believes all Wyomingites deserve real representation. Her campaign slogan is "A Senator for the Rest of Us." And Jackie Grimes is running for Wyoming Senate District 10, which covers the east half of Laramie as well as much of rural Albany County outside of the Laramie city limits. Jackie lives in Laramie and she is running because she wants to create a future for all Wyomingites. So we're going to cover four kind of key topics in this order. We're going to first jump into healthcare and then go to kind of jobs, the economy, and then we'll turn to climate change. And then we're going to end with talking about representation and what that means. Depending on time, we'll see if there are questions coming in on the chat, and I'll try to incorporate those as well if it makes sense to. So thank you, Lynnette, Yana, and Jackie for being here and participating today. We'll go ahead and get started. So COVID-19 has brought several issues front and center in our country, including our healthcare system and impacts on jobs and the economy. And of course, those things are tied together. As millions of Americans have lost jobs, many have lost their health insurance as well. So I'd like to start with healthcare first. Lynnette, you live on the Wind River Indian Reservation, which has been hit very hard by this pandemic. Fremont County has seen 322 cases and 9 deaths, the highest of any county in Wyoming. And across the country, we've seen that Black and Indigenous people of color are seeing disproportionately higher hospitalization rates and death rates. There are many factors and layers that may potentially contribute to this, including underlying health conditions, working in industries that present higher risk of infection, jobs that may not offer sick leave. But certainly one primary factor is less access to adequate health care. Lynnette, what kind of changes do you think are needed in our healthcare policy to move towards equity in healthcare coverage?
Thank you for the question. That's a hearty answer to give to that. I think there's different components of policy that can be addressed, especially specifically for Indian country. So my response right now is basically in our Indian healthcare services. So Native Americans have health disparities all across the line. And we don't have adequate healthcare coverage to combat the health disparities that we face in our tribal communities. And a part of that reason is because we have an agreement with the U.S. government that they are to provide healthcare services to the 560 recognized tribes in the U.S., and we are always underfunded when it comes to Indian health services. So to try to make that relatable to other people who don't live in Indian country, this is an example that I can share. So in order for us to have adequate health care in Indian country, we would compare it to what prisoners get in the federal prison in the US. In order for us to have adequate health care in parallel with what prisoners get in our federal prison system, they would have to double our funding in the country. That's how underfunded we are when it comes to healthcare services funding from the US government. And also in regards to that, there's a whole trickle-down effect of issues that comes with that. We have, there was a survey done in 2018 on health disparities in Indian country. It shows that Native Americans who suffer from health disparities that are treatable do not get the treatment that they need, meaning the references, going to see specialists, especially when it comes to diabetes, kidney function, liver function. These are like the top and respiratory issues. These issues we don't get references to. We don't get to see specialists on. And so our people die because we're not able to get these referrals. We're not able to go out to other places where we can see these specialists. These are treatable illnesses, but yet in Indian country, we die of these illnesses. Native Americans have the lowest life expectancy rate in the US. The numbers fluctuate from year to year according to the Census Bureau survey, but it ranges from anywhere to 44 years old to 50 years old. So me, as a full-blooded Native American, that is my life expectancy right now in those age range. And so part of that is because we don't have adequate healthcare services in our tribal communities. That is funded by the US government. And this is with treaty. This has all come from treaty agreements from years ago. And again, to paint you that picture, you know, if I was a prisoner in the federal prison system, I would have better health care than somebody on the reservation. So I would definitely focus on policies that would help funding of the IHS Indian health services that we have across Indian country. I think it's same things you see in urban settings when it comes to African Americans and Latinos who don't get adequate health coverage, or that do not receive the referrals that is needed so that they can have a healthy life.
Thank you, Lynnette. Yana, turning to you, what kind of healthcare policy would you support, and how would things look different today with a reimagined healthcare system?
Yeah, thanks for the question. This is one of my my big issues. So I am in favor of single payer healthcare, and part of the reason for that is that you know, Americans spend about 30% of our total healthcare budget on private insurance. And private insurance doesn't actually get us anything. I mean, essentially, we are paying private insurers to gatekeep for us and tell us who we can go see, what kinds of services we can get, what kinds of tests we can get done, you know, all of that stuff. It's really up to our insurers to tell us what we can have access to. And they add a layer into the healthcare system that isn't truly adding any benefit at all. And single payer that eliminates private insurance is actually the one plan that completely gets them out of the picture. And that's important for another reason as well, which is that, you know, insurance companies make their money off of healthy people. They don't make their money off of sick people, and they know that. And so if you have a dual system where we have a, you know, Medicare for all who want it thing, which is how some people are talking about this, and then private insurance, those private insurance companies are going to dump all of the people who need genuine care off of their rolls, because they can do that knowing that people are going to be able to access healthcare through the federal government. And this is basically the direct pathway to making every Republican's nightmare about some kind of public health system come true. It will be incredibly expensive if we keep that dual system in place. And one of the ways that it would be different is that people wouldn't be coming out of the hospital right now surviving COVID-19. Like, imagine that you have been through this horrific healthcare crisis. You come home and you get hit with $100,000 bill. And then other people around you watching that, when they start getting sick, are going to be very reluctant to go to the doctor and to get a test and to get the care that they need. And so I think we would absolutely be seeing fewer deaths right now we would be seeing fewer people headed for medical bankruptcy, which is already the #1 reason why Americans go bankrupt. And we could also, because our medical professionals right now, every medical office in the country, whether that's a private office or a hospital, they have a bunch of staff who deal with really complicated medical billing, trying to figure out who gets a bill, what do they get it for, what kinds of things are we charging where, and that whole thing would get eliminated, and our medical industry could actually focus on medicine more than complicated billing issues. So the second thing that I would favor is having either strict caps on drug prices or actually turning the whole pharmaceutical industry into public utilities. And Colorado has just done this with insulin. They've put a strict cap on insulin costs. We could be doing that across the board, which means that they'd still be able to make profits on it, but they wouldn't be able to make the kind of astronomical profits that they're making right now. And often on drugs that we paid for the development of. I mean, one of the COVID-19 drugs, we have $70 million of our money went into developing that drug, and that company is looking at charging $2,000 a pop for something that costs them about $10 a pop to make. There is nothing ethical about that system at all. And the final thing I would name is having a strict, no tolerance policy on discrimination, whether that's for queer and trans people, immigrants. I think you should get medical coverage in this country regardless of your immigration status. And also, I just learned a bunch of stuff from Lynnette, and it seems like we have some issues there as well, where our tribes are being treated clearly as second-class citizens in terms of healthcare, and I think we need to give everybody the same healthcare. So that is what I would do.
Thank you, Yana. Jackie, a lot of times when people think about healthcare policy, we're thinking about it at the federal level. So there are these broad federal policies that drive the healthcare system in our country. But states can take action as well, and many do, to ensure that people in their state are protected. What types of healthcare bills do you think the Wyoming legislature needs to pass to best protect and support Wyomingites and ensure everyone has real access to healthcare?
Those of you who knew me back in 2018, people kind of view me as the education candidate because I work in public education, but it's actually healthcare that has me the most fired up, particularly because our state has repeatedly failed to pass Medicaid expansion. And when you look at other Republican-held and run states that have passed it, they have seen immense gains for their population. And when we look at Wyoming as a whole, 27,000 of our residents stand to suddenly have access to medical health care coverage by the simple expansion of Medicaid. In addition, over the course of the next 10 years, we would save 1.3, well, it's not save. Over a 10-year span, we are wasting $1.3 billion by not expanding it, because the thought is we keep saying it's going to cost us money. We are already paying for that expansion. We are taking Wyoming dollars and we are allowing them to be gifted to other states to cover their healthcare costs by turning this down. And the logic behind this is using some crystal ball thinking of, well, 4 or 5 years from now, what if we can't pay this bill? Then it has to, become, if they get rid of Obamacare. They've been trying to get rid of Obamacare for the better part of a decade, and it hasn't happened. The Affordable Care Act has not been reversed. There has not been a replacement put in place. So we're putting lives of our residents in the hands of a crystal ball and making assumptions about something that has not come to pass, and we're allowing people to go without health care. And I think that is a giant mistake, and if you can't get on board with that because of just the moral and ethical ground of we should be getting health care for people, we should be doing it on a financial basis, that we're willing to allow Wyoming dollars to go to somebody else. The Wyoming dollars should be serving Wyoming people, and we really need to be focused on keeping that money here to benefit our residents. In addition, we have to think about the impact of COVID. The reality is that people are starting to lose their jobs. Businesses in the next few months here, those that have not already closed their doors are likely going to start closing even more so. So people who were getting company-sponsored healthcare access will now be without coverage. I've heard the argument made that there's COBRA insurance, right? Cobra healthcare insurance costs more than my mortgage payment. And even more so when you factor in my husband, myself, my 2 children, we're looking at thousands upon thousands of dollars that people who do not have an income are expected to be able to contribute and pay to maintain their health insurance coverage. And it's just not an actual viable solution for anybody who has just lost their job. And so we have to look at this as a preemptive move to support those who are going to be, who were not economically fragile to begin with, who are moving into a new state of existence where they might not have financial security for a while. And we have to, as a state, say, we've got you. We're going to make sure that you can have access to health care. It also stabilizes our rural hospitals and our rural medical communities who have difficulty with billing and payments because they provide care no matter what. But if someone isn't able to afford health insurance, they certainly cannot afford a medical bill. And so this is something that we do for the health and well-being of our entire state. And as we continue to fight this pandemic with the very real reality that we will be facing another second wave that is likely to be more impactful to our state than what we are facing right now, this needs to be in place proactively to ensure that we can have a healthy workforce to continue to drive our economy. Because if everyone is home sick because they can't access medical care, or they're sick and they go to work because they can't afford to not go to work, we're going to be in a really bad situation. So this is just common sense, reasonable solutions to the realities that we're facing. I also think we need to be examining our healthcare premiums. We're close to double the healthcare premiums per person than neighboring states, and not looking at states like Colorado with really large populations and huge healthcare systems. You can look at Idaho and the Dakotas, and you can see that we're at about $800 a month per one person to about $450, $475 per month for a person in another neighboring state who face the same kind of rural sprawl that we do, who still have the same limited health care access and resources that we do. So there is no rational reason why our premiums should be higher than our neighboring states. And that has been allowed to continue partially due to lack of competition, partially because we don't have Medicaid expansion that's going to help us drive the cost of our healthcare premiums and make that, the need to make it more competitive with some of our private insurance companies. And we really need to address that because a family of 4, which is, the average family size here, they're looking close to $2,000 a month in health insurance premiums to insure insurance for their families. That is higher than the average mortgage. So when families are looking at, do we buy insurance, or if they decide to do it, they're not buying homes because they can't afford it. They can't afford $2,000 in a mortgage and $2,000 in healthcare premiums. Then those premiums do not actually impact anything as it relates to co-payments. Costs for medication, that medication does not actually go to premium, your cap spending for the year. And so this starts to get really expensive to receive health care in Wyoming. The other thing that happens is because we have such a limited pool here, in terms of how we can access healthcare, lots of our healthcare is actually driven out of the state. I'm probably a prime example of this. I'm a high-risk category for breast cancer. Had my mom and 2 aunts both had breast cancer at a young age, and so I already get annual mammograms at 37 years old because I'm about the age now that all of my relatives develop breast cancer. I went for my mammogram a couple of weeks ago, and went down to Fort Collins because they have a center that specializes in breast care health. And that's really important to me. And when I was getting ready and doing my paperwork, it was a different reality because, the masks are on and all of that. But talking with the registration person, they laid out for me, we have 2 mammogram options. We have the traditional 2D mammogram, and we have now acquired new technology for a 3D mammogram, which actually sees more tissue that can prevent the need for follow-up testing because we can see more what's happening in your breast. It's particularly important for those who have fibrocystic breasts, which I actually have, and the majority of women actually have. And so their caveat was, your insurance company may not cover this 3D mammogram. this is how much they cover for the 2D, and they'll apply that to the 3D. And so at most, you're going to be looking at an additional $107 charge to go the 3D route. But when I looked at the cost providing here, I know I've always had to go for a follow-up diagnostic imaging situation because I have fibrocystic breast, so I have multiple copays and multiple deductibles for multiple imaging, which ends up being more expensive than the $107 difference. And I am in a financial position where I can say, I'll pay the extra $107 to not do a diagnostic test later on. But that's being driven by insurance companies who are making that policy. That's not based on good quality healthcare, because my providers would say we should be skipping 2D mammograms altogether for her because it never turns out right. It never gives us good information, but the process requires that I go to that first before I can get to the thing that's actually going to work for me. And that's a problem. It costs people more money. It actually costs insurance companies more money in terms of like good benefit. Like, it's just bad business ultimately when you start to break that down. So at the state level, we have to start examining what is it that we're allowing insurance companies to charge our residents? What can we do about it? What caps can we put on in terms of medication cost caps, insulin, some of those really important things that people need every day, and what should be expected from that? A lot of things that get left out of the discussion that can cost a lot of money is actually eyesight. And eye care, that's an additional insurance that you have to provide that's not a part of normal health insurance. But I don't know a single person who's got eye issues that can operate unless their vision is corrected. I've got contacts in right now. If I had these out, I likely would not see much of what's on this screen right now. But we have to pay additional premiums to get vision insurance. And then we have to pay quite a considerable amount to get glasses or contacts or whatever we need to do to correct our vision. And we see this as separate. We start to see so many things of this is this like very narrow window of healthcare, and dental isn't a part of that, even though we know that's connected to heart disease and all kinds of other health outcomes. And vision isn't a part of that, even though you can't participate in any kind of society if you can't see. Mental health is not health. We're going to separate that out. We're lucky that we got parity here, but we still view it as separate as health, which should be the person as a whole. And so ultimately, as a state legislator, part of what I would love to see is actually a national state campaign that looks at changing the cultural perception of what is health for a person and raising that bar and expectation in terms of what we expect for health to really fulfill that, life part of life, liberty, and pursuit of happiness. There is no life without health, and we really have got to start to address that on a cultural level, on the way that we legislate, on what we are doing as a society. So that was my very long-winded answer to your question, but healthcare is something that I think is just a fundamental right, because you cannot do anything else if you do not have health.
Thank you, Jackie. Yeah, you touched a lot on the costs of health insurance, and your response was a nice segue into our next set of questions on the economy, because certainly all of these healthcare concerns have been exacerbated by COVID-19 and its impact on the economy and on job loss. Between mid-March and mid-April during this COVID-19 pandemic, over 26 million Americans filed for unemployment, and in that same time frame, the total wealth of billionaires in our countries increased by $308 billion. Yana, starting with you, you identify yourself as strongly pro-worker, and you've talked about curbing corporate and CEO power. What kind of policies would you endorse to bring better balance to our country's wealth disparity, and how would that affect the average Wyomingite?
Well, I'm not sure the answer to this one is that different for Wyomingites than it is for Americans in general. And so there's two key stats with this. I mean, one is that the average CEO to worker earnings ratio is 361 to 1. And I personally believe that like no one's life energy is worth 361 times anyone else's, and yet that is considered normal right now in this country. The other one is that Indigenous and Black families have a fraction of the wealth that white families do. And so we have racial inequities and, there's both race and class discrimination going on in how we have things set up right now. And so some of the policies that I would be looking at, one of the things that I am proposing is a wage ratio law And what this basically says is that nobody in a company could make more than, maybe it's 20 times what somebody else in that company could. And that's still a pretty big discrepancy, but that is what it was in 1953. And that was a time where, when you actually look at the economy in general in the United States, we actually had a middle class. You could make it on one salary for a family, and that would cover home, education, transportation, healthcare, all of that stuff. The second thing is, pairing with that, increasing minimum wages, and, $15 an hour would be great in a lot of places and is not adequate in a lot of places. And that's sort of the brass ring that everybody's holding up right now. So what I would like to do is actually see a combination of this wage ratio, raising the minimum wage to $15 an hour, but also having a living wage provision on top of that, which basically means that the least expensive county in the country, minimum wage would be $15 an hour. In a place where you actually need $40 an hour, like, that living wage would kick in, and that would actually be the minimum wage in that area. And so businesses that are in places where it's easier to make a profit would be required to pay their employees more money so that it's actually a living wage. One of my core things that I'm really interested in is worker ownership, like moving away from having a separate owning class where the 1% basically owns almost everything in this country in terms of what produces value. So, Marx would have said the means of production, workers owning the means of production. And so I am strongly in favor of making it easier and strongly incentivizing moving toward worker ownership. And one of the things that Bernie Sanders has proposed that I am in favor of is a workers' first right of refusal law. And so I'm not talking about suddenly, like, everything gets taken away from the people who own it right now and gets transferred to the workers in some forced thing. What I am talking about, though, is that if a company goes on the market, workers should have the first crack at being able to buy that company out. And I would like to see the federal government offer low-cost loans to workers and help with things like business planning and figuring out what they actually would need to do to become the owners. Worker cooperatives have a higher success rate than non-worker cooperative businesses do. Workers generally make more money, they have better benefits, and they never, 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 ever say something like, Sam is just so much better than we are. He should be making 361 times what the rest of us are. Worker owners don't do that. They end up with, much more equity within their companies. And then two more things that I'll mention quickly. I want to ban the practice of CEOs and executive bonuses happening during bankruptcy filings. So right now what we've seen, and this actually would touch a lot of Wyomingites pretty directly, what we've seen is coal companies going through repeated bankruptcies, and those CEOs and those higher up execs are walking away with millions of dollars in bonuses at the same moment that workers' pensions are going away and their paychecks are bouncing. And that is utterly unethical, and that is really about how our bankruptcy laws are written. Actually, I'm going to do two more. So postal banking would be great. I mean, every community in this country has a post office. It used to be that you could cash your paycheck at a post office, and now you can't do that. And about a quarter of Americans are either unbanked or underbanked, meaning they don't have access to banking services, and a lot of them end up dealing with predatory paycheck lenders, and where they may end up owing 5 times what their paycheck was in the first place because they were 48 hours away from being able to cover all of their bills, and so they went that route. Postal banking would give all people in this country, and especially poor people, access to basic banking. And the last thing I will say is that we need to actually do reparations, and it needs to not just be with African Americans, but also Indigenous people. And what that looks like needs to be led by those communities, because that is where our big wealth discrepancies are. And there's lots of brilliant, interesting ideas that have been tossed around, and I think we need to actually pass. There's been a House bill that's been proposed every year that John Lewis has been in the US House and has never passed. We need to actually pass that, do that study, and commit to following through with reparations.
Thank you, Yana. Lynnette, turning to you, another issue that's been highlighted in the wake of COVID-19 is the impact on the food industry. So that's restaurants as well as Wyoming's ranchers and farmers. What kind of policies would you endorse to support restaurant owners, ranchers, and farmers?
Well, looking at some numbers, I'm a numbers person. I always look at statistics. I always look like what is affecting a group or an entity. So according to the USDA's most recent World Agriculture Supply and Demand estimate suggests that decline of in commodity value for 2019, 2020, and 2021, production adds up to almost $60 billion. This does not include all the agricultural losses, which would be in the billions more. The economic losses across the U.S. and has widely hit our agriculture sector. And it has directed the supply and demand chain partners as well. And so I think moving forward, we have to look at how COVID is going to continue to impact our country in the next year or so. With that, I know that we will be visiting more COVID-19 relief fund packages, but we need to expand those packages and expand those relief funds to our farmers and agriculture sector in the U.S. For us here in Wyoming, we have a big, agriculture and farmer industry. I have families who are farmers and who is directly impacted by this, especially with their crops. Not only with their crops, but also with their cows and the animals that they have. It's been hard for farmers here and ranchers here in Wyoming and nationwide. So I would like to see relief fund packages directly to farmers and agriculture. Also, I think that we need to extend the Farming Support to States Act, which provides resources to state and local departments of agriculture. This will provide relief funding for our farmers and agriculture, not only in Wyoming, but nationwide. And this is all interrelated with our economic issues that we have due to COVID-19. I think the COVID-19 relief funding that addresses agriculture and ranchers has been very minute. And I think we need to expand that so that we are not having our families directly impacted, a double loss, so to speak, due to the COVID-19 issue that we have here in our country. And for our restaurants, I think Wyoming is quite unique if you compare it to other states. We are a rural, small town state, and these rural communities that we all live in and love we have mom and pop shops all up and down our state. They are the bread and butter. They are the heart of our communities. And so with the COVID-19 relief funding, I think we need to also look into our restaurant sectors, not the franchise sector, but the ones who are the mom and pops, as we understand and know, that the latest relief stimulus package was benefited by millionaires. Millionaires was able to get millions more based off the stimulus recent package. And our small restaurant owners that we support in our own communities were not able to get that assistance. So I would like to address those things with our farmers and agriculture, which also impacts our small and pops restaurant owners as well.
Thank you, Lynnette. And building off of that, my question for you, Jackie, is small businesses in Wyoming are suffering right now. Restaurants, as Lynnette mentioned, retail shops, childcare centers, and many other businesses that rely on that face-to-face contact. How can our state better support small businesses?
Before I jump into that, I actually want to kind of carry over a little bit of what Lynnette was talking about as it relates to our agriculture and ranching communities, particularly because it's easy right now for us to focus on like how COVID has impacted us, but our agriculture and our ranching communities have actually been struggling much longer than that due to these contests between our current president and other countries and these standoffs that occur that have resulted in exporting coming to an almost absolute halt, which has resulted in ranching and farming communities losing tons and tons of money and the government offering a fraction of a bailout to kind of hold on to them so that they can carry through, but really offering no real long-term solutions. And then COVID hits, which makes it even harder. And so I would like to see more states actually get involved in that battle, because the way that I see it right now, our ranching community was in the process, our state legislatures have actually been working for multiple years with China to build a relationship for exporting and getting China to buy Wyoming beef. And when this battle between China and President Trump began, that came to an immediate halt. So we were finding an avenue and place for us to have international exporting power and ability to kind of grow there. That came to a halt. And that is interfering actually with the state's ability to conduct business. Because when we start to look at exporting, that is revenue sources for the state because it's Wyoming beef and there's, tracking that goes along with that. And so really that has interfered and shut down some production in a state that's already suffering economically. I like some of the legislation that we've done in terms of agriculture, in terms of being some of that more of that local processing and being able to keep our ranches keeping things here versus exporting to another state, paying taxes to another state to process meat, and that state getting, especially Colorado getting Wyoming revenue that could be kept here. So I like that has been done a little bit. I'd like to see more of a marriage, honestly, between our agriculture and our tourism industry, because when people come to Wyoming, they come for the Wyoming experience. The number of people who've come into my family's restaurant when they've been traveling through Wyoming and ask, what's Wyoming on this menu? What can I get on this menu? And we have to say, I'm sorry, I can't afford to buy the exported Wyoming meat back to Wyoming so that you can have this bison burger, because it would be $30 and I know you can't afford to pay that. And so it's not cost effective for us to do that. Because when you come here, you want the real experience. You want to feel what it means to be in Wyoming. You want that Wild West experience. And if there's a way for us to better market that and keep that unified together and capitalize on the experience that people want to have when they're here, I think that is a source of revenue that we need to be pursuing. Now, in terms of small businesses, my husband is a small business owner. He owns a local restaurant, and I can just tell you right now, in terms of what I've seen at the national, federal level and at the state level, I feel like has been woefully slow and has come out and rolled out in such a way that it has hurt our local small businesses. Most businesses in Wyoming, because our population is so small, operate on such small margins of profit that a couple months without profit folds a business. The asking to hold on, hey, we're going to meet, it's going to be in 2 months, hold tight, is really an impossible ask for small businesses who do not have backing from franchises or big corporations to keep them afloat. Our family has used that payment protection plan so that they can pay their employees a salary. That has been really helpful when they were finally able to get it. However, there are shortcomings here that happen. When you own a small business, your own salary as a business owner has not actually been addressed in any of our stimulus packages to help maintain them. So the government is, we will pay for your employees to have an income, but you can't have an income. And the only way you won't have to pay this back is if you keep paying your employees, which means you have to stay open and you have to do it for free because the profits aren't there and you're not actually making a salary yourself as a business owner, which is why we're going to see more and more businesses start to falter. Wyoming's also not necessarily unique. This is kind of a nationwide battle. When we say child care facility, I try to avoid saying child care because it's not child care. It's early childhood education. And individuals who work in these industries have degrees on par with public educators in terms of that expertise of what it takes to teach students how to become K-12 students. We have higher expectations in K-12 now. Preschool used to be where you learned all of those social behaviors that you need to operate in an educational setting. So you learn how to line up, you learn how to share, you learn maybe how to spell your name, maybe you learn how to be cooperative, follow rules, operate within a set space so that when you started kindergarten, you had those foundational behaviors and things ready to go. Now, early childhood education, it's uppercase and lowercase alphabet, basic mathematics, knowing how to spell, multiple words. You have to know about 20 sight words before you start kindergarten in order to have a leg up. It's not just watching your kid. It is teaching them the skills they need to access the curriculum and to make educational gains. And those who don't receive it, those are the kids who are behind for years. They're more likely to be identified for special education, which ultimately ends up costing the state and federal government more money for interventions and things like that. And research consistently shows that when you invest in early childhood education, you pay less down the line because they need less interventions. They have those skills. They got all those precursor things they need in order to succeed in school. I bring this up because when we talk about local economies and businesses, this is happening nationwide, but it's definitely true in Albany County too, where our child care facilities, as they are known now, are on the brink of closure. They operate in very small margins. Right now, the average cost for early childhood education is about $850 per child. So if you have 2 kids, you're again looking at more than an average mortgage payment for your children to access early childhood education. And what we have seen with closure with COVID is the inequity in early childhood education. K-12 has had the bonus of having already pre-built in budgets and funds addressing keeping them open and helping sustain during this closure. Our early childhood centers are operating on such small margins that they are likely to face closure. Then how do we get our economy started if we have nowhere to put our children? Because the reality is that we have created an economy that requires 2 incomes to sustain a family at this point. We do not have a one-income society. And so there is no world in which we reopen and go back to business as normal if we have not done our due diligence to ensure our early childhood education centers are able to remain open and have the funds to adequately do so and do so safely. This is where state legislature needs to come in. It has been a constant battle and conversation about absorbing and moving early childhood education out from the umbrella of the health department and into education and funding through the education model and including that in our educational spending and planning. If we had done that before COVID, our economy actually wouldn't be facing necessarily as much of a crisis as it is likely going to when we realize we don't have our workforce because half of our population is having to choose between a job and having somewhere to have their kid. We've seen it nationwide where that hits women more than other partners and other individuals more than hits our male population of when it comes down to choice of who's going to stay home. If kids have nowhere to go, it tends to be women. We are a strong workforce. We contribute immensely to our local economies. And so unless we have a plan to address this, I am so disappointed with our federal government that they have not rolled something out. Our state government also has done some things and they've re-pulled back in some nonprofits. So our nonprofit childcares are getting a little bit of our boost, but our for-profit childcares are not. And that is problematic. And so we need specific strategic planning in this area in order to make sure that we can continue to move on so we don't see such devastation. Now, what I actually want to see happen, I've talked about a lot of different things, but what I actually want to see happen is what other nations have done. Because what we are all talking about here is scrambling. We are scrambling to fix our economy. We are scrambling to come up with plans. We are scrambling to do things. And we're resentful and we're angry and we're tired and we're sick of following these rules and we're sick of doing things because we are scared because we are all 1 month away from losing the things that we've worked to have. And other countries have done this better than us. We had a one-time bump stimulus payment that is actually going to impact any refund maybe you will get next year because it's coming from your taxes. It's not just coming, it's not gifted money from the government. You will see an impact next year. Other governments have responded better by making sure that there has been a standard income for all individuals of their nations during this time so they haven't had to worry about our business is going to close. Well, they're not going to close because the people who are running them are not dependent on whether or not an adequate profit is occurring right now to support keeping a business open. They haven't had to worry about child care centers because families can stay home with their kids and still have income coming in, and those who are working and running the child care facilities have an income. economies continue to be boosted because people have money to purchase things. When we look at how things closed down in Albany County, man, those who still had jobs that were not furloughed and had an income, they were the ones who were stimulating our local economies. They were the ones who were going on to social media and creating business accounts and saying, hey, let's give a shout out. How can we give a boost to our businesses and buy things? Because we know we have an income and other people are struggling and we want to see our businesses stay open. And so really, as a state, we need to be fighting back at the federal government going, listen, you helped us in April. It's July. Nobody can make $1,200 last from March until July with the economy that we are facing. And you need to stop fighting and you need to get some help to families and individual people right now because they're not making it. And we are creating a bigger problem that will far outweigh and outlast COVID if we do not start responding more responsibly and more directly to people. And so really when we want to talk about that local piece, there's all these things that we need to do. We need to do it more quickly. They need to act and respond to more CARES funding more quickly. They need to be looking at what is the federal short side here that we need to be responding to as a state, but they need to be putting pressure on the federal government. We need to be looking at our US elected officials and say, stop getting in front of a microphone to point fingers at somebody else. Get the job done. People in Wyoming are struggling. Stop fighting. Get help for our state.
Thank you, Jack. A lot to unpack there. I want to kind of shift gears here and talk about climate change and energy. And Lynnette, I think we'll start with you. You've talked about the fact that the extractive industries have enormous influence in Wyoming. And you've talked about the need for a just transition away from those industries in order to address the existential threat of climate change. What does a just transition look like to you?
I think because of COVID-19 and the things that we face in this country, I think there is no better time than right now than to just transition. I know people groups and other people out there have been fighting the renewable energy industry for a very long time, but this may be an answer to an economic issue that we face, not only on a state level, but on a federal level. I know that the extractive industry, the oil and gas industry, is the heart and soul of Wyoming. I too have a family that are oil workers and works in the oil fields and have lost their jobs due to COVID-19. So I know personally what the impact is on the oil and gas industry here in Wyoming. However, I don't plan to leave anyone behind. I want to make sure that they still have employment. And one of the things that we can do to be innovating and to address the issues that we are facing is to move to just transition, renewable energy industry, which will also create jobs. It would create jobs, it would create economic value to the state and to the federal level. But all things considered, it would also impact our climate. Climate change is a huge issue. I don't like to see people say, oh, it's not real, it's a hoax. Those of us who know and understand the importance of climate change, it is real and it's something that we need to do. And as leadership, it is your responsibility to address climate change. Tied with all of the things that is going on with the economic issues that we face, the COVID-19, and of course in Wyoming, here we have the extractive industry. This would be a good innovative way to not only create jobs, but to move forward in helping our climate and protecting our climate. Renewable energy is something that I'm fighting for and I'm promoting, and I hope that others can see that this will be a benefit to families across the nation.
Thank you, Lynnette. Jackie, back to you. What are your thoughts on climate change and specifically steps that Wyoming could take to have a positive impact on the climate?
Sure. I think Wyoming's kind of poised to be, if we really wanted to be, we could be the front runner. Like we could set the example for everybody else. We've been known as the energy state. We can still be the energy state. I would agree with Lynnette here that we're going to have to find a just way to do this, because what we're asking people to do is go from making a six-figure salary and assuming a job is just a job. And I don't know how we ask people to make a transition without making sure there is a secure, viable income to do that. Because if I were someone who was making six figures and then I was told, here, you could work at this other company for $30,000 a year, I probably would be, nope, not interested, and I don't want your industry to come here. We really have to be systematic and just on how we make this transition. But I think there's some smaller things to do, because a lot of what we talk about when we talk about climate change are these really big actions that need to happen. But the smaller things add up to big change. So for example, we have an unbelievable amount of sunshine. An unbelievable amount of sunshine here in Wyoming. I say that as someone who grew up in Wyoming, I grew up in Michigan, where my last winter there, we had 16 weeks without sun. Not 5 minutes, not a peek through, not coming through the clouds, 16 weeks with no sunshine. That is not our problem here in Wyoming. We have sunshine even on bad weather days. We have sunshine, and we have a lot of roofs. There is no reason why we can't be making that more economical for people to swap out and put roof panels on their houses to absorb that solar energy and then reusing that. Even Rocky Mountain Power is looking to partner with people to store that energy use. And we can look at those partnerships to do that on a bigger scale in a way that is affordable for people. And those who can't afford the upfront cost of it, how can we get them still solar panels on their roofs? Or how can companies who want to invest rent rooftops? I'd be happy if Rocky Mountain Power was like, I want to get the solar energy from your roof. Have at it, buddy. You can put whatever you want up there. I'm good with it. You can rent some space. We certainly do that with other areas, and we can capitalize upon that here in Wyoming, because that is a huge piece that we could use. The other thing that I really want to think that we should be considering is those one-time plastic uses, those one-time disposable. Now, in the time of COVID, this is a really hard conversation to have because it's not reasonable. But we have an opportunity to start laying the foundation to make that reasonable and attainable. Laramie had passed we were going to get rid of plastic bags. We were making the steps towards that, and then COVID hit, and it's sorry, you can't have your reusable plastic bags. It could be germ-filled sacks coming into the grocery store so we don't spread more of COVID. But if we start laying the foundation to get rid of those one-time use items, that would have a huge impact on our waste. That would have a huge impact on the animals that get impacted by plastics that we use and we dispose of that are not biodegradable. That would help drive down the cost of using biodegradable items for businesses to access. My family's business, we've looked at things like, man, if we could get the cultural buy-in that you bring your own reusable to-go containers, we would happily fill those up. That would save the business money. We don't have to buy those to-go containers that don't break down well. And that's a cost saving for businesses. What can we do to take practical, everyday steps for minimal impacts? And then make that actually attainable and reachable for families who can't afford it. Because when you start to look at some of these things, these are big upfront cost investments. If you're going to be buying stuff that you're going to use on a regular basis, and not everyone can afford it. So how can we do this equitably? How can we make sure that everyone has access to it? Because it's not going to work unless we're all in it together. The last thing that I think is really, really important, and I'm a little bit fired up about it, having just read my opponent's proposal today of bringing in real estate developers from Seattle as a way to address our economic crisis here in Wyoming. We have got to protect our public lands. I look at the thought of a real estate developer coming out here and looking at Wyoming's wide open spaces and just thinking that's a piece of land that should have a property on it, and we can sell it and we can make lots of profit off of Wyoming. Wyoming is wild. We are free. We do not want to look out windows and see more buildings. That has been very well established by those who live here. We like the outdoors. We like having public lands that we can have access to hike, to go hunting on, to maintain the kind of lifestyle we have here. We don't want to be Seattle. We don't want to be Colorado, where we look at our land as profit. instead of valuing what it brings to our community, what it brings to our state, having those spaces open. And so ensuring that we're able to do that, because that would be a really easy solution that, you know, many of our state legislatures and our US representatives have actually pushed really hard for, which is to have the state take back over federal lands. We're in an economic crisis. So what's going to happen as soon as we get them? They're now state-owned, so now we're going to sell them. And it's going to go to the highest bidder, and the rest of you are no longer going to have access to these things. And so there has got to be protections built in for those of us who live here for our wild outdoor value, our nature lifestyle. And we have to work hard to protect that. So it's not just taking steps of what can we do to change, it's how do we prevent, excuse me, more damage and harm from happening at the same time. I'm gonna go grab something to drink. So, excuse me.
Thanks, Jackie. All right, Yana, turning to you. You support a Green New Deal, but there are some different versions out there. Can you talk a little bit about the key provisions that you think are important to be included in a Green New Deal and how they would affect Wyoming specifically?
Mm-hmm. Yeah, well, and I'm going to try to be short about this and just like reference people. Like there's like hours and hours and hours of me talking about climate disruption online, including on our Facebook and YouTube pages. And so I'm going to just I'm just going to give you like 3 principles and some examples of what falls under that. I mean, number 1 is racial and economic justice has got to be built into it. Number 2 is that we need to work both sides of the equation, not just reducing our emissions, but getting CO2 out of the atmosphere that is already there. And number 3 is localization. And so it needs to be racially and economically just for a couple of reasons. I mean, number 1 is the majority of emissions that have come from countries that are primarily white people and are led by white people, and the majority of impacts have been on brown and black communities and bodies and countries. And I think until we actually reckon with the fact that I think racism is one of the things that has driven our emissions, I think we're going to have a really good time actually doing real policy that is going to serve all of the communities that need to be served. And it needs to be economically just because, frankly, if you are poor, you are forced to make terrible ecological decisions. If all you can afford is McDonald's to feed your kids, you are going to go through that drive-through, and that is how you're going to feed your kids. And there's a whole host of reasons why the fast food industry is terrible for the climate. And so I could say a ton more about that. I'm not going to right now. The second one is working both sides of the equation. And so yes, we need to bring our emissions down. And that's going to include things like renewable energy and public transit. It's going to include things like sustainable agriculture projects and getting us off of fossil fuels. And a really sticky topic, you know, the US military is the single largest contributor to fossil fuel or to carbon emissions in the world. And we need to actually look at that and be willing to look at how our military presence in 170 countries in the world might actually be one of the things that is really, really feeding the climate crisis. So that is the reduction end. On the end of getting carbon out of the atmosphere, there's a lot of people that are looking for like some fancy tech fix for that. And the reality is we don't need any tech that we don't already have. The best way to get carbon out of the atmosphere is to plant a tremendously huge amount of plants. And so, you know, climate scientists are saying 1 trillion trees getting planted worldwide would be the biggest single thing that we could do. And I'm proposing that the US take responsibility for 10 billion of those trees, which is, you know, harking back to the, you know, Civilian Conservation Corps. I mean, this is not a new thing. You know, we did it the last time the US was in like a major crisis. We can do it again. The second piece of that is legalizing marijuana and letting people plant and grow for their personal use. There is no faster way to get thousands of Americans to participate in climate justice than to legalize pot and let them grow it. That would create thousands of farmers that we don't currently have in the country. So then the third principle is localization. So anything that we can do to localize our economies. So that's local food, local businesses, local entertainment. That is transportation systems that, you know, if every community had some sort of public transit going, we could get off of cars. If we had rural broadband, that would reduce the amount of commuting that people are doing considerably. And we've seen during the COVID crisis all the ways that, like, a lot of our people haven't been able to work their jobs from home because our internet access in Wyoming sucks in a lot of rural places. And so finally, one other piece to that is microgrids. And so right now, as I've been driving around the state on this campaign, I have spent hours driving next to nothing but electrical wires. Our big grid is incredibly inefficient. We lose a lot of electricity to a thing called line loss. And if we had microgrids, not only would we be more secure, I mean, it's actually a major safety risk and security risk in terms of international security for us to be on one big connected grid. Microgrids would be more secure, and they would also be a way that we could create a local utility or a local co-op business or whatever that would own that infrastructure. And we wouldn't have a situation where when the grid goes down, our rural communities are the last people to get their thing back on. Those communities would actually be in control of their own grid and in control of their own production. And that would be incredibly beneficial on lots of different levels. And I'm not going to say the 75 minutes more of stuff I want to say.
Thank you. I am learning so much from all three of you. This has been really great so far. So I just have one last set of questions. And in the interest of time, I'm going to ask each of you to try and keep it under 2 minutes. But I want to talk quickly about what real representation looks like to you. 2018 was a huge record-breaking year for women running for office. And we're seeing this year that wasn't just a fluke. We were just getting started. I read this morning that so far 574 women have run or have filed to run for US House seats, surpassing 2018's historic record of 476 women. So that was a record, and we have about 100 more women running this year for US House. For US Senate, 58 women have filed, surpassing the record-breaking 53 in 2018. And so far this year, 1,343 women have filed for state legislature in their respective states. So Jackie, starting with you, if we look at the percentage of seats held by women in state legislatures across the country, Wyoming ranks 48th out of 50 states, the third worst state in our country, just barely ahead of Mississippi and West Virginia. Out of 90 total seats in the Wyoming House and Wyoming Senate, only 14 are held by women. Why is it important to have more women in the state legislature?
There's a couple of reasons. First, I'd like to say we have a legislature that, because it's a citizen legislature, it makes it very difficult for anyone to really consider running for office, particularly women, because unless you live in Cheyenne, it's really difficult to navigate how you would take care of your children and also serve at the same time, because you would be very, very far away for a really intensive period of time. And so that can be really problematic. One of the reasons why I think it's really, really important, we have a retired legislature. Most of our legislature is doing this as a retirement project. It's what they're doing in their, golden years, so to speak, and don't have a real connection or idea as to what is happening in our state and what is impacting the residents who are living here. And we need more representation at the state level in order to write better legislation, to make better decisions. We have a pretty non-active legislature in the sense that we commission lots of money to study things and then never act upon anything. And that's okay if you're retired, because none of these decisions really impact you. But when it does impact you, you're left holding your breath for years, hoping for something to change when the change needs to happen now. We cannot just hope eventually, well, next time when we get together in, February, we'll see if we do it better next time. We don't have that kind of time to hope that it's going to turn out better. We also are woefully inadequate in representing women and women's issues when we talk about healthcare and healthcare access, when we talk about the cost of childcare. COVID really shined a light on things that when we start to talk about essential employees, they are jobs that are typically occupied by women that are often significantly underpaid, and yet we are telling them that they are so essential that our economy cannot survive without the work that they contribute, and yet their wages don't represent that. Wages and wage inequity is huge in our state, and research has consistently demonstrated that the more women that enter an industry, regardless of the industry, the more women who enter it, the lower the pay becomes. We do not value the work that women provide, and yet we cannot survive as a society without it. And we certainly don't make those decisions at the state level, and we need more women to bring that argument to the table because it's certainly not being represented or adequately addressed.
Thank you. Lynnette, turning to you. In 2018, 2 Native American women, Sharice Davids and Deb Haaland, were elected to Congress, and they are the only 2 Native American women to serve in Congress. You are a proud Northern Arapaho Hunkpapa Lakota. Can you talk about the importance of Native American women being represented in our government?
Yeah, absolutely. Well, really briefly, again, going back to the work that I've done over in a decade, I'm statistics. I'm big on statistics and research. And so in my work, I've always been focused on Native American statistics in the country. And one of those things is that, I always say when I speak is I'm before you as a full-blooded Native American woman. And the statistic that hangs over my head is that I am the most stalked, raped, sexually assaulted, and suffer domestic violence 50 times higher than a national average than any other woman in this country. And to go ahead and piggyback off that statistic, Native American youth have the highest suicide rates in the nation. I have already stated that we have the lowest life expectancy due to health disparities that we face in our tribal communities. And there's a long list of other statistics that we top the worst statistics in this country. So we look at the U.S. House of Representatives, we don't see that reflection of ethnicity, diversity, inclusion in that. In comparison to African American community, there's 162 African Americans that have served in Congress, Senate, and as delegates. And here we are, we have 2 Native Americans in 2018 that entered into the U.S. House of Representatives. I think because of the social divide that has occurred in our country these past couple years, I think it's a better time, there's no better time than now to see diversity and inclusion in our U.S. House of Representatives, in our policy and leadership on a state level and on a federal level. It is a personal mission of mine to change these statistics, regardless of what role I play in that. But on a higher level, if we look at being represented in Congress as a Native American woman, I would be able to not only impact and direct and try to focus on how these policies affect the nation, not for just Native Americans, but for all people of color who don't see the same equality that we also do not see. And I want justice. I want equality. I think most of us do, regardless of what party affiliation that you have. But when you have representation in the U.S. Congress, you're able to have colleagues in that position. And I would play a role in winning those colleagues and seeing the viewpoint. For most statistics, these people don't know. Some of you probably don't know some of these statistics. Some of you are probably unaware of the things that we face. But if it impacts one community, it's going to impact other communities. And I always say that. So I think it's highly important to see all ethnic races in our U.S. House Congress. And I would be honored to serve in that.
Thank you. Yana, you've spoken about erasure recently, the erasure of LGBTQ+ individuals, youth, Indigenous peoples, Black erasure and Latinx erasure, disability erasure. You want to end the erasure and represent all Wyomingites. Can you talk a little bit about this erasure, kind of how and why it happens and what might be different with real representation of underrepresented communities?
Sure, yeah. I mean, we all have biases. We all have particular things that we are focused on because of our own life experiences. And I believe that people legislate from what they know, and they legislate for who they value. And Wyoming has a very, very, very bad track record with this. I mean, as far as I can tell, everyone who has ever represented us in DC has been white, straight, and able-bodied. It's been almost all 1%ers and almost all men. And in fact, our US Senate seat has never been held by anyone other than someone in all of those categories, as far as I can tell. So when you're in there making decisions, it is almost automatic that you're going to filter things based on what your biases are and what your own life experiences are. I don't think people who haven't been poor have any idea how most of their policies affect poor people. Having tried to make it on $10 an hour in the last few years in Wyoming, I know that that is not a living wage, and that is very real to me, and it is very personal to me. Same things with being a queer person, same things with having a lot of people in my life, who are immigrants, who are people of color, and who have dealt directly with racial discrimination. And having sat over a beer and heard those stories, I want to make sure that those stories are being taken into account when we are actually legislating. And when I look at leadership right now in DC, what I'm seeing is that the younger the person, the more they're on it with climate issues. The most inspiring leadership in DC right now, as far as I'm concerned, is coming from young women of color. And I think it's because they have so much of that intersectional experience with being left out and being erased previously in the legislative process. And so I'm interested in going to DC really with an attitude of solidarity. And I'll also add that, like, the disability community in some ways gets the shortest end of the stick. Like, we're not even talking about marriage rights for people with disabilities. This is really, really, really erased population, and it is the largest minority population in the United States. And, if you're not going to go and hold all of those different groups, then you're not actually representing the state. You are representing the white 1% straight, able-bodied male portion of the state. And that's actually not very many of us. And so I think it's really critical that we have, real representation. And, obviously I'm not a person of color, I'm not an immigrant, but I do understand solidarity. And I think it's important that we go there and we go to have each other's backs.
Thank you. Well, thank you so much, Lynnette Grable running for U.S. House, Yana Ludwig running for U.S. Senate, and Jackie Grimes running for Wyoming Senate District 10. You all really very thoughtfully covered quite a lot in some very complex and layered topics, and I really appreciate hearing from and learning from all of you. Yana, I'm going to turn it back to you to wrap up.
Yeah, great. Thank you. And thank you, Carrie. You did great with this role. I super appreciate it. So I need to, because the FEC, regulations paid for by Yana for a while, it's important we have to say this with every video that we do. So also want to thank my fellow candidates for being here today. Thank you so much, both of you. And also just want to make a quick announcement that our campaign just released a new campaign ad today that we're super excited about. So please go check it out. It was really fun to do, and we got a lot of different voices into it. So check that out. And thank you so much, everyone who came to listen in and everybody who is listening into the recordings at this point. Thanks, and we'll catch you out there on the campaign trail. All right, bye, everybody.